Good afternoon. If you can hear me, can you raise your hands or say yes in the chat box, please? Can everyone hear me okay? I hear some feedback in the background. If you can press *6 on your phone, that would be great. Wonderful. Welcome, welcome everyone. We are going to wait just another minute or so for folks to come on in the room, and we'll go ahead and get started. Thank you for taking time out of your busy day to spend lunch with me, and we'll get started in just a minute. Welcome and good afternoon. This is the fourth installment of the South Carolina Office of Rural Health in partnership with DHEC's Best Chance Network and Wise Woman Programs training series, The Front Desk, the gateway for effective patient engagement for Best Chance Network and Wise Woman Programs. My name is Tiffany Simpson-Crumpley, and I will be your presenter for today. I'd like to thank all of you who have taken time to have your virtual lunch with me, and I truly appreciate your commitment to serving women who need these services the most. I'd like to welcome not only South Carolina attendees, but also our attendees from out of state. I saw that folks registered from North Carolina and Georgia, so welcome. And while we'll be talking about South Carolina, much of what we'll talk about today will be applicable to your programming. Please indicate if you can see my screen. I just want to make sure that everyone can see it. And you can also indicate just by raising your hand if you can see my screen. Let's go ahead and get started. So by the end of today's webinar, our goals are the following: to learn basic information for participating in the Best Chance Network and Wise Woman programs. Learn about the impact of the patient care experience on show rates for new and follow-up appointments and compliance for treatment, and on your practices or clinics' financial success. Finally, by the end of this webinar, we'd like to impart at least 2 practical strategies for providing an excellent customer care experience and increasing engagement for BCN, Best Chance Network, and Wise Woman participants. Just a little bit about me as your presenter. My name is Tiffany Simpson-Crumpley. I am a native of Oakland, California, and the greater San Francisco Bay Area. I hold a bachelor's in health science as well as a master's in health services administration. I began my 20-year career as a medical admitting clerk and a community health worker. So for all of you that work the front desk, for all of you that may be community health workers, I will be informing from that perspective in terms of what happens at the front desk and how important and key your role is in providing a wonderful patient care experience and your role in keeping patients healthy through the human experience. Finally, I have 10 years of experience of developing systems of care, creating access points for uninsured and underinsured adults in North and South Carolina. A quick review of what we've learned about so far. As I referenced, this is the 4th installment of this training series. The first webinar focused on the nuts and bolts of implementing a great Best Chance Network program. The second webinar talked about using your EHR to engage patients in your BCN and Wise Woman programs. And last week we discussed billing for success, tips and tools in terms of making sure that you can generate revenue from your BCN programs, as well as Wise Woman. In each of these trainings, we featured people that are doing this work on a regular basis so they can impart that knowledge to you so you can be successful in generating revenue for your practice. So what have we learned from these last 4 trainings and what I've learned in terms of talking to folks all across the state about a great Best Chance Network program? We've learned that the building blocks of successful programs really centers around 4 aspects. Number 1, you must have a practice champion. That can be the medical assistant, that could be a nurse, that could even be a front desk staff person, but one person has to be committed to working the program. That means from start to finish, making sure that everybody knows their role and plays their position in terms of making sure women get in for screenings, what does the registration process look like, and really being committed to reminding that woman to come in on a yearly basis for her screenings, whether they're for breast cancer, cervical cancer, or high blood pressure. So we will be talking about both programs together, and we will be intentional about that today. Other aspects of successful programs also focus in on having an activated EHR screening process, being able to proactively pull reports of the population that will qualify for services and being proactive in reaching out to them. We have also found that successful programs use telephonic patient alerts either through their EHR system or investing in systems like Televox, where patients can receive text messages to their phone reminding them to come in for their annual exams. Also, in the last webinar, we talked about billing and coding knowledge for BCN and Wise Woman programs. If not anything else, the ladies at DHEC emphasized the importance of fully completing the forms for each visit for a BCN and Wise Woman program participant in order to be paid promptly for the services that you provide. Also, submitting forms 30 days from the date of service. So those are the main takeaways from the first few webinars. And at the center of it all, so we talked about who needs to do what, what you need to do with your EHR system. We talked about what you need to do to get paid for these services. But at the center of it all is the patient themselves, and that's what we'll be talking about today. So we have all these blocks, but at the center of it all, if you do not have effective communication with the patient from start to finish, it can impede the entire process for providing care to patients. Just some really quick information about Best Chance Network. Essentially, it is South Carolina's brand for the National Breast and Cervical Cancer Early Detection Program. This program provides comprehensive screening and diagnostic services for underinsured and uninsured women. Often in the community, it is referred to as the free mammogram program. However, there's much more to Best Chance Network than mammograms. They provide Pap tests to screen for cervical cancer, pelvic examination, HPV testing, and other diagnostic testing if necessary, and referrals for further treatment. So not only do they provide services for screening, but if abnormal test results come back, they provide follow-up care and funding for that as well. Quick eligibility criteria for the Best Chance Network program. The woman must live in South Carolina, be 30 to 64 years old, and exceptions are made effective July 1st for cervical cancer screening. Women can be as young as 21 years old, and if a woman is symptomatic and has a history of breast cancer in her family, she can be approved for Best Chance Network services. This patient must not have health insurance or are underinsured, meaning that their coverage may only cover hospital care. Now, if the woman is insured and has a policy from the Federal Insurance Exchange and her deductible is $1,000 or higher, she also qualifies and must meet income eligibility guidelines. For more information, you can consult the DHEC website for more information. What is Wise Woman? Since 2008, DHEC has offered the Wise Woman program to reduce risk factors for heart disease in low-income women 40 to 64 years of age. Wise Woman provides cardiovascular screening in terms of high blood pressure and cholesterol screenings, basic lab tests, health coaching, and lifestyle changes to bring down weight and control high blood pressure. We are intentional about presenting these programs together. I consider them the dynamic duo because of the clinical linkages of uncontrolled hypertension and cholesterol and its connection to being a risk factor for developing cancer. So we are intentional, and in fact, you cannot be a Wise Woman provider without being a BCN provider. Again, must be enrolled to be eligible as a BCN patient, must be a South Carolina resident, and in terms of income and insurance status, very similar to BCN. So just wanted to give you a visual of what breast cancer mortality rates look like across the state of South Carolina. If you look at the hot pink area, this is considered the PD region, and it is the hardest hit by breast cancer deaths. Interestingly enough, this same region has the same trend for cervical cancer deaths. And now we look at heart disease mortality rates. So very similar trend in terms of where women are hardest hit by heart disease. And so again, in that red area, that is the PD region of our state, and then in the low country is that particular risk as well. So let's talk about the who is served by these programs. Challenging long-held myths that beneficiaries of these programs are mostly African American women who are on welfare, are not working. Most women served by the BCN and Wise Women programs in our state are actually poor and working class white women. African Americans are the second largest group to be served. However, while white women develop breast cancer at a slightly higher rate than black women are more likely to be diagnosed with late stage breast cancer and cervical cancer, and they have a higher risk of dying earlier. When we talk about heart disease is the second leading cause of death for all women in the state of South Carolina and the leading killer of African American women in the Palmetto State. So here's some just basic statistics of the numbers of women that died in 2013 from heart disease, the number of hospitalizations as a result of heart disease, and the amount of dollars spent on hospitalizations, $1.24 billion. So imagine if we could ramp up and provide the needed screening so unchecked high blood pressure and high cholesterol does not develop into heart disease in the first place. So let's get into the nitty-gritty of why we are focusing on the patient care experience. The experience of the patient determines their level of trust in your services and you as a provider. It determines quote unquote compliance with prescribed treatment, and it impacts the financial health of your facility and your business overall. So really quickly, be thinking about the questions that you want to ask as we go through the presentation and put them in the chat box. And we have dedicated time for Q&A. So be thinking about the questions that you want to ask. So let's talk about what current BCN participants have experienced since being in the program. In 2016, DHEC, or the Department of Health and Environmental Control for our state, hired an independent evaluator to run focus groups across the state. Here are the top 3 barriers to care that were shared. Number 1, bad attitude from front desk staff. Some ladies spoke of they felt like they were being treated as a charity case. Sliding fee scale policies. And directly connected to that is not getting appointments because of outstanding bills. So we're going to take a look at what a patient care experience looks like. This video is provided courtesy of University of Mississippi Medical Center, and we will launch right into the video. So, what did you all think about what you just saw? What did you observe in the video? If there are some of you that would like to sound off about what you saw, please raise your hand. So, quick, what did you observe in part one?
Hey Tiff, this is Andrew. I don't think many people could hear that video, but there was some connections or some type of problem with the video.
Okay. Okay, so
I'm not sure. I don't think you're going to get much feedback with people not being able to hear that.
okay, well, I apologize for that. But essentially, in the video, if you read the body language of the front desk person, the lady arrives and she's about 15 minutes late for her appointment, nearly 20, I think. And so basically, when it opens up, it's a group of ladies gossiping at the front desk. She's standing there, they're waiting for her. She's just waiting there, and it's almost like she's invisible. And so basically, they carry on this whole conversation. And then when the ladies step away, the receptionist doesn't even say hello, doesn't say, hello, my name is so and so, how can I help you today? It was like name. She's rolling her eyes, she's popping her gum. And so I know that y'all haven't done that in your everyday work, but I just wanted to provide an example of some of the things that our women have experienced in the BCN program in terms of care. And so when we really think about it, if you think about your experience going to a restaurant and ordering your favorite meal, and the waitress treats you horribly, are you likely to come back? And then just the whole idea of being shamed and humiliated. So I really wanted to share that. Unfortunately, I'm sorry that the connection was not good, but I just wanted to give you an example of the type of treatment that our patients face. Now, again, does that excuse some of the challenges that we have in terms of serving patients who may not treat us well? No, but it also just indicates that we need to be mindful of our interactions with our patients. And so in part two of this video, it really talks about what an ideal patient care experience looks like. So in that video, there are no ladies gossiping at the front desk. As soon as the lady arrives, she's greeted with a receptionist that has a smile on her face. How can I help you? And really just walks her through the registration process. Though she is late, she looks at her and says, let me see if I can get you in, and accommodate her because she encountered traffic. So I apologize for not being able to show you that video today, but I just wanted to show you an example of what a bad care experience at the beginning of one looks like and one after. So another barrier to care that was discussed was the sliding fee scale and outstanding bills. So if there are those of you that are representing health centers, community health centers, or federally qualified health centers, let me just say this is the experience of our patients. We realize that FQHCs are fully committed to serving patients. However, we do want to be frank about what is experienced by patients across the state. What the law states. Section 330 of the Public Health Services Act says that a health center must operate in such a manner that no patient shall be denied service due to an individual's inability to pay. However, the reality of some patients when they go to certain health centers is that they experience difficulty receiving services because of their inability to pay fees according to the center's sliding fee scale policy that becomes outstanding bills. And so what happens is that when there's an outstanding bill, they cannot get a follow-up appointment, and this serves as a barrier to care. The consequences of a poor patient care experience. Damaged patient-provider relationship. A patient may choose to opt out of the services they need the most because she does not want to endure continued mistreatment. Economic burden. In 2014 alone, inpatient hospitalizations for primary diagnosis of breast cancer cost South Carolina $44 billion. Bad reputation in the community. Patients vote with their feet and by word of mouth. One clinic's patient burden can become their competitor's opportunity to provide a comprehensive medical home. And as we know with many of our patients, they may be uninsured now, but if we provide quality care and stabilize their social determinants that they are facing, they could eventually get a job and become covered and be able to provide payment for their care with employer-sponsored health insurance. So just really continue to rethink who we think self-pay patients are. And ultimately, when patients feel like they are not welcome, they are not valued as human beings, this ultimately has higher cost in terms of morbidity and mortality. If a woman does not get screened for breast cancer, she may sit out of care, and by the time she is finally screened, she has late-stage cancers, unmanaged chronic disease, and yes, even premature death from sitting out of care. Strategies for improving the patient care experience. Practice makes perfect. Commit to having regularly scheduled team meetings and customer service training at least annually for all staff, not just front desk staff. My experience as a medical admitting clerk has taught me that when there's not good team work, when folks don't feel valued in terms of their role at the front desk, it translates into stress, and ultimately sometimes what ends up being a not so good attitude because they don't feel supported. So again, while the front desk sets the tone, it is also an indicator of the culture in that particular healthcare facility. Be fully prepared to confront and address a work culture that perpetuates poor treatment of patients based on class, race, or insurance status. So let's talk about some of the elephants in the room. At the end of the day, we are here to serve patients. We really must check our political views and social biases at the door. And if that is difficult for you as a staff person, or if that culture exists, it's ultimately going to affect your bottom line. And again, patients talk to each other in the community, and if they have a poor patient care experience with you, it will ultimately translate to loss of dollars and cents. So I've discussed just the idea of confronting all of us, that we have biases, we have preferences, but at the end of the day, I challenge everyone on this call to practice what I call radical empathy, the ability to be in that person's shoes, in that moment, in that time, and that at the end of the day, our end goal is to provide good patient care. And if that's difficult, perhaps your staff may want to go through training together and begin to unpack some of those things. So really just addressing the elephant in the room. We in the focus groups, information came forward about even how a woman is dressed when she seeks care. If she's dressed professionally, she's served a certain way, and if she's perceived as poor or not being dressed nice, it also translates to how she was treated in the care process. Leaders, managers or managers, directors in medical facilities must include equitable patient care guidelines and clinic policies and procedures in the manual, but also making it a way of doing business in terms of staff conduct standards, and have a system of accountability connected to that. Strategies continued for improving the patient care experience. Managers should work the front desk periodically. One of my most vivid memories, I'm currently in Atlanta, Georgia, but I worked in South Carolina for 5.5 years for the South Carolina Office of Rural Health, and I'll never forget when I went to a federally qualified health center, and I walked in for a meeting with the CEO, and the CEO was working the front desk. So that is the level of commitment that if I have administrators on the phone, it is helpful for you to go up there and not just monitor what your front desk is doing, but understand how stressful the job is and really support your staff in being able to provide the best patient care experience by really looking at their work on a day-to-day basis and adjusting workflow accordingly. Ask patients how they're doing. How many of us have been to a restaurant and we're enjoying our meal and the manager stops by and says, how is your meal today? How was the quality of service? We can do the same thing in healthcare settings, and you will get spot on feedback in terms of whether or not you're on the right track in terms of how you serve patients. So, in terms of sliding fee scale policies, federally qualified health centers are required to have those policies. However, I do know that there are FQHC directors and leaders that have opted in some situations to revise their policies to accommodate women for the BCN and Wise Woman programs. In South Carolina, we have the Healthy Outcomes program where we serve uninsured patients and connect them to a medical home. And there are community health center leaders that have said our greater goal is to treat the patient, and they have waived outstanding bills or made an arrangement with the patient so they can continue to receive care. So that is just one example of the type of policies that need to be revised, because sometimes inadvertently our policies or the structure of how we serve patients may be a barrier to their care. The other piece of this is rethinking our perspective of self-pay patients. When we go back to the experience of women being treated like they were a charity case, the point to emphasize here is while services are provided free of charge for eligible women in the Best Chance Network and Wise Women programs, South Carolina DHEC still pays for those services, and you are ultimately being paid for the services as well. And in some cases, and particularly in the case of South Carolina, they reimburse at a better rate than even Medicaid. So if we just take a look at bringing one woman in and providing the whole array of services for Best Chance Network and Wise Woman, assuming that their eligible forms are filled out correctly, that is a potential to earn $444 per patient. Now, in other states, your fee schedule may be slightly different, but this is the type of money that's being left on the table when a self-pay patient is not treated well. You're literally allowing $500 to walk out of the door. And so for our rural practices that have 3 full-time employees and need manpower to implement not only this program but other ones, that could translate to another staff person or just stabilizing, being able to pay your staff better or being able to offer more comprehensive services with the revenue that you could bring into your practice. Answering the WIIFM question. What's in it for me? Increased revenue from initial screening appointments and follow-up appointments for both programs. By serving as a point of entry for breast and cervical cancer, as well as cardiovascular screenings through both of these programs, you have the opportunity to keep that patient in your medical home. For Wise Woman, in addition to the screenings, these women receive free diabetes prevention education, lifestyle coaching to promote healthy eating and physical activity. Also, if you build your foundation around these programs, it aligns with other quality improvement measures that translate to better payment for your practice. So if you are going through the patient-centered medical home accreditation process, much of what we've talked about today is required in those standards. For your HEDIS measures, if you perform better in terms of patient satisfaction and implementing these screenings, you can renegotiate your contracts with payers. And this goes for the physician quality reporting system as well. These are just some examples of alignment with PCMH and meaningful use measures that are accomplished by implementing the BCN and Wise Woman programs. And then the same for HEDIS and MACRA. And this is what I call the keep it simple patient care principles. And just going back to just old school customer service. Number one, smile. Greet the patient when they come to the front desk. Give and maintain eye contact with them. Keep in mind that many of the women that are served in these programs are the working poor. Before they walked into your door, they have a whole set of life issues and they have a story. And just as you want somebody to be empathetic towards you when you are sick and you don't feel good, we need to remember that when we serve patients like the women that are served in these programs. Share your name and ask how you can help. Number four, explain the check-in and care process in plain language. While all of us have worked hard to do the work that we do and we have these pieces of paper called degrees, we want to be sure that we are coaching our patients through the visit in terms of what to expect. For many women, they've never had a mammogram and they are scared. So really preparing them like, this is what the process looks like today. This is what you can expect from us. Also, what we've learned is don't assume that patients can read forms. Do not hand a form to a patient and expect that they may be able to complete it. Be prepared to help a patient with limited reading ability and help them fill out forms. If English is the patient's second language, please provide translation services prepared to do that telephonically, or hiring staff that reflect the population that you serve. So bilingual, bicultural staff, people that can work the front desk. And this also comes down to promotional materials, flyers in your lobbies also. And going the extra mile. I remember as a medical admitting clerk, I often served patients who could not speak English at all, and there would be long wait times for medical translators in the hospital where I worked. So what can you do? Pick up, and in that case, most of those patients were Spanish speaking. So you may want to pick up some registration language in terms of being able to speak to patients and help them through the process. And treat patients as though they were your family member. When we talk about the BCN program and Wise Woman program, I always try to think of my mother or my auntie or my sister walking through the door, and how would I treat them if they were coming in for services? So plainly speaking, treat these women like your mama, treat them like your auntie, treat them like your sister, and everything else will fall into place. At this time, we have a question and answer session. If you have any questions, please type them into the chat box and I'll be more than happy to answer them for you. And if you have any comments, feel free to raise your hand and I will unmute you, and you can also ask your question live. Okay, if there are no questions, I'll proceed.
Tip, there's some in the question box instead of the chat box.
Okay, here we go. Andrew, for some reason I can't see the question.
So a couple of them, let's see. A couple people have asked about the presentation, and we can make sure we disseminate a copy of that. Another one is how do I know to apply for BCN Wise Woman? So I'm not sure if that is how to apply as a BCN provider. I would assume that's the only way.
Yes. So in
Um,
terms of, I'll tackle that question. So in terms of becoming a Best Chance Network provider, at the end of this presentation, Trinessa Jones is the director of the Best Chance Network program for the state of South Carolina, and you can sign up directly with her. So that information will be provided on the last slide of this webinar. In terms of the presentation being disseminated, this will be recorded and it should be ready within 24 hours, and you will automatically receive a message that the recorded session is ready, and you'll have the recording and the slides. Andrew, do you see other questions?
yeah, give me just a second. I'm looking through them. Let's see. Are the forms for the Wise Woman the same as the BCN forms is another question.
No, each program has its own forms, and what will happen is if you are already a BCN provider, then you would sign up with Linda Peccary, who and I'll also be providing her information at on the last slide. So Wise Woman has a completely different set of forms, and that's why it's critically important that you have a designated staff person that knows both of these programs, because in order to be paid, that staff person really has to have good working knowledge of those forms, and also to be able to inform clinicians of what they need to be capturing during the patient visit. So to answer your questions, each program has its own set of forms.
And to add to that, if you are already a BCN provider and you have access to Medit,
Yes.
which DHEC provides you access to, you're also able to access all those forms for both BCN and Wise Woman in that in the Medit system once you become a provider.
Yes.
And then there are a couple questions about qualifications for patients to. Let's see. Somebody wrote, we do not have many patients that do not qualify for the Best Chance Network Wise Woman. For the ones that do, will there be a change in income bracket for them? Then they corrected it, said, sorry, for the ones that do not qualify, will there be a change in income bracket?
Um, that is a Trinessa question. Let me see.
That's fine. We can follow up on that. Just that was a question, and these will all be, let's see. And
Trinessa,
actually,
are you
she
on the
just
line?
responded. She
Okay.
said, yes, in the new fiscal year, the FPO will be 250% at or above.
Okay.
Or she meant below, sorry. So at 250% at or below.
Okay. Other questions?
Yes, there's a few others. I'm going through them. Just give me a second. Somebody asked if you could display the slide for the patient participation qualifications, so I guess the eligibility.
Okay. For Wise Woman or Best Chance Network?
It says patient participation qualification, so if you have, I don't know if you have access to both of them very quickly, but
So this is this is eligibility criteria for Best Chance Network services.
and so the eligibility for this is the same, everything but the age is the
Yes.
same between Best Chance and Wise Woman. So
Yes.
the age is the biggest difference there. I think it's what, 30 to 64 for Best Chance and 40 to 64 for Wise Woman, I believe.
Yes. Other
Let's
questions?
1 second. If a patient becomes in and sliding fee scale has not been turned in, should they still be allowed to be seen for BCN without any proof of income?
I know, I think if you're at a federally qualified health center, my assumption is that that is a requirement that you do that. One of the things that I think is important is that as front desk staff, sometimes the director may make exceptions, but if the front desk staff does not have those exceptions to that sliding fee scale rule, then all you can do is your job based on what the policy is. So I would not say, I'm not going to tell you, I'm not going to have FQHC directors coming after me saying not to turn in the sliding fee scale forms. I think you still go through your financial screening process, but for programs like BCN and Wise Woman, the bigger issue at the end of the day is that this is a source of revenue for a patient that is self-pay, and they may not be Medicaid eligible, but yet they really don't have enough money to even pay the fees according to a sliding fee scale. So I guess that is the takeaway from all of this, is that there has to be opportunities, and FQHC directors have the discretion to make those decisions. But once those decisions are made, that's where the team meetings come in. So those policies and those exceptions to the financial screening process are clearly communicated, so front desk staff are empowered to activate those options for those patients when they come to you. So I hope I answered that question for you.
And I've got something to add to that, Tiffany. So women must meet the residency income and age requirements for both programs before consideration can be given for insurance. But payment through the Best Chance Network and Wise Woman are guaranteed through DHEC.
Yes. Yes.
So I would agree, I would go through your normal screening process because you will have to have that information at some point. So.
Right.
Let's see. So somebody asked, when did we say the eligibility income level will change from 200 to 250 at or below federal poverty level? I believe that would be June 20th. June 30th. I apologize. So that would be June 30th, 2017 is when that change would go into effect. So June 30th is when the new fiscal year begins, and to go to the 250% at or below the federal poverty level.
Okay. Any other questions?
And yes, the webinar PowerPoints will be available, and we'll make sure that you all have access to the recording. You should be able to just log on to GoToWebinar and do that. But we'll make sure everybody receives a link. So this question and answer session, you'll get some of those, and we can also maybe try to type up some of these as well, at least the questions with the answers, the ones that we saw multiple times.
Okay.
And let's see, I'm not familiar with this one. It says, what is the age limit for cervical cancer screening? 20 years old or so?
So, Trinessa, if Trinessa can sound off on this, but based on what has been shared with me, is that 21, they will move the age back to 21 for cervical cancer screenings through the BCN program.
And that's exactly what she told me.
Okay.
Yeah, I believe right now it's 30 to 64, but yes, in the new fiscal year, so June 30th, 2017, it'll go to 21 to 64. And so some more guidance on that, and just in general with the updates that we've kind of mentioned, some more information will be coming up with that, and we'll make sure we help disseminate that. So I do have a question, and Trinessa or Linda, help me with this. So there won't be any age changes with Wise Woman. It's just the BCN that will be changing. Is that correct? Yeah, just BCN. So there was a question asking if the if the change will happen, if that age qualification will also change for wise women, the answer is no. It's still going to stay for 40 years old to 64 for now.
And Andrew, this question has actually come up before in our team meetings. The idea, if a man develops breast cancer, can he be treated? And I believe Trinessa has approved men to participate if they develop breast cancer. Is that correct, Trinessa?
It's a case-by-case basis. So I guess there would be some different things that would need to be looked at or something, but she says that it can be treated on a case-by-case. So if you were to have that occur, I think there was a question about it. The best thing to do there is going to be contact Trinessa Jones at DHEC and or the patient navigator. So if you're in contact with a regional patient navigator with the BCN network, they can help you with that and give you some more information. Okay, I'm being corrected. No, the in-house patient navigator, so I apologize for that. Let's see, a couple other questions and then we'll start wrapping up. Let's see. Will BCN cover if the patient has been diagnosed with cervical cancer?
That's a good one. That's Trinessa.
And if we need to unmute them,
I think we should, because so many questions are coming forward. Let me unmute Trinessa. Trinessa, can you hear us? I just unmuted Trinessa, but I can't hear her.
I wonder if it.
So Trinessa, if you could put that in the chat box in terms of if a patient has already been diagnosed with cervical cancer, are they eligible to be covered through BCN services?
Okay, she's suggesting that anything like that, so a little bit further in-depth questions, some things that are not necessarily probably day-to-day, they're gonna need to contact the patient nurse navigators. They have those in-house.
Okay.
That's going to be the best way to address that, and she's happy to help get people in contact with that. They would need all of the documents and reports. So if that were to be the case, they're probably going to want to look at some past history or something with that. They have 4 nurses here in their cancer division that can help with this. So we can get people in touch with that. Let's see. This is probably, we can start wrapping up maybe after this one. We only have a few minutes left and get everybody back to their days. This is probably something that may be in the future as well. We have a question that somebody's asking, will BCN look into include colon cancer screening in the future?
There is a whole separate colorectal cancer screening initiative, and we have your information. And I actually know the lady. Her name is Renee Caldwell, and she implements that program. But I don't have the information. But there's a whole separate program to deal with colorectal screening.
Yeah, and that's probably a higher level question, because currently, it may be something that the CDC or somebody would have to help with, since the Best Chance Network is kind of through that. So right now it's just going to be breast and cervical cancer, unless something at that kind of level were to change. So
yeah, there is indeed. There's
some other programs to do, though.
So we'll get back to you in terms of the exact program information, but I do know the program, the lead navigator for the colorectal cancer screening initiative for South Carolina. So I will email that information to you once this is over.
Okay, Tiff. So I think everything has kind of slowed down. So I think if there aren't any other questions, we'll make sure that we do our follow up here and
So there's
make
just
sure we get everybody in contact with the correct people.
Right. So just a couple of housekeeping things. We will be having weekly webinars. So next week, we're going to get into the specifics of what is Wise Woman. What are the nuts and bolts of implementing a Wise Woman program? So that will be next Thursday from 12 to 1 o'clock on the 18th, making the case for Wise Woman, why rural practices need to be providers. From our vantage point and the whole driving force of this call, as you've seen on the map, some of the hardest hit places in terms of breast cancer, cervical cancer, heart disease, deaths happen in rural communities. So we are committed to increasing the number of providers that are offering these services and providing technical assistance for such. And by doing that, we increase the number of women that could potentially be served. In June, we'll talk about the win-win. How does implementing Wise Woman benefit your practice and set you up for improved quality improvement, but also better payment in your practice. And so on 6/8, because Wise Woman has other moving components to the program, we're going to talk about billing specifically for Wise Woman. So these are for people that are already implementing Best Chance Network and want to become Wise Woman providers. And finally, on June 28th, again, South Carolina Office of Rural Health in partnership with DHEC's Wise Woman and Best Chance Network programs, we will be hosting a live health coaching boot camp. So if you are a BCN provider and you would like to add on Wise Woman to your services, we are hosting a live boot camp, and we would like, if you are interested, you can contact Linda Peccary, and her information will be on the next slide, and designate a person to attend the training that you'd like to be a health coach for your practice. And so again, stay tuned for that in terms of registration information. We are planning that as we speak. Again, we're here to help. Not only do we provide technical assistance with increasing rural providers, with the program, we also, this is under the umbrella of the Center for Practice Transformation. So if you are interested in pursuing patient-centered medical home accreditation, we can help you. MACRA, if you need technical assistance with preparing for that, we can help you with that as well. If you are a physician practice and looking to acquire rural health clinic reimbursement status, we have staff that can walk you through the application, the compliance process, and give you billing and coding advice. Finally, last but not least, Trinessa Jones, this is her contact information if you'd like to become a BCN provider. Wise Woman, Linda has attended today and she's in the room, but this is her contact information. And my name is Tiffany Simpson-Crumpley. I'm honored to serve you as your education and training consultant and the hands-on, what's happening in the practice. Do you need help with your EHR? Do you need to get signed up? My partner, LaShonda Pettaway Brown, is available to assist practices that are existing providers or thinking about implementing and need to make sure that their internal work processes will support the implementation of this program. I hope that what we have imparted to you today has been helpful in your work. As always, if we knew better, we could do better. So there are 4 questions that will pop up at the end of this webinar. Please, please, please take a minute just to give us feedback about what you heard today, the ways that we can improve this training series, and we'll see you next week. Thanks so much for spending your lunch with me.